I just went to go pick up the patient, and I'm looking at the patient. I'm like, this is odd. The patient is literally turning blue, and there was a nurse in the room prior to me coming in. They didn't take it out, and this patient is sweating, like breathing fast. And I'm like, oh wait a minute, this is not up. It's wrong. So you scream, hey, I need some help here. And by the time the help get there, you are pushing that code button and
Welcome to Married to Nursing,
the podcast where we pull back the curtain on healthcare.
Hey, welcome back to Married to Nursing. I am your host, Anna, and this is...
I'm Armand.
That's my husband, y'all. We're a husband and wife who have been nurses for over decades. Though my husband is still in the nursing field, I have transitioned out of nursing into entrepreneurship, and that's what we do here, is take you behind the scenes of nursing care, of what nurses see that patients never get to see. Patients, caregivers, family members never get to see.
Like usual, everything that we discuss on this platform is from a plethora of experience that we have had. It's nothing to do with any particular patient. So we are not disclosing anybody's information here.
Yes.
Okay.
Yeah.
So, yeah.
All right. So today we are going behind the scenes, taking you behind the scenes of what is actually happening during a code blue, which is a cardiac arrest, when a patient goes into cardiac arrest. Because we know that there's a lot of fear, there's a lot of questions around that. And also we'll talk about what happens afterwards.
Okay.
So, because usually during a code, the patient's family members and caregivers, they're sent out of the room and they're escorted somewhere off
what the situation is happening.
Right.
And the patient code, somebody noticed that, so immediately we'll push the code button
blue button
on the wall, and everybody start rushing into a room.
Somebody's grabbing a crash cart.
Yeah, you're calling the attending, you're calling the rapid response team to come, and everybody is working, start compression on the patient. And at the same time, in a hospital setting, you have oxygen available and somebody is giving breath. So
there's a lot that's going on, and this is why they tend to move the patients' family members out, because it's scary.
It can be very scary.
People swarming into the room. There's so many people in that room at that time, and
there's orders being yelled all over the place. The crash cart is popped open, medication are flying out. In a split second, you see a lot of things on the floor that are like left and right.
Yeah.
So that's why usually after a code, you see the room is very messy.
Messy.
It's very messy.
I hated during those code because it's so tense. It's so, like, you have to think on your fast on your feet, that critical thinking, especially when you are that patient's nurse.
Exactly.
Everybody's looking.
Person is asking you question. Okay.
Yeah.
When was the last time this person eat? When is the last lab result? What medication did they take? Like, what are they here? Okay. When is the last time you check on this patient? What has been happening all throughout the day? So
you better be answering.
You better be on your toes. Like, everybody is like, you pull the chart, you start, reviewing, tons of data.
At this time, it's not the patient's nurse that's documenting, right? It's the ICU nurse that's also.
So you kind of assign roles to everybody. Somebody is doing compression, somebody is documenting. So the person that is documenting is also timing when medication is given. The
documenting job is the one that I never wanted, because you have to pay very close attention to what medication, what time it was given, and writing everything that everybody is doing.
So especially when you are doing compression and the medication is given, there is a certain amount of time before another dose of the medication can be given. So the person recording has to speak back and saying, okay, medication given a minute ago or 30 seconds ago. Okay, whenever it's time for the next dose, person will say, okay, next dose is due. So everybody has a specific role, and everybody needs to know what is their role in the whole process.
And during that chest compression too, one of the reasons why families are taken out of that room is because it looks like they're trying to kill the patient. But
Yeah.
because like you're pumping
Mhm.
hard on that, and I remember, or I've heard stories about when it's a frail elderly
Adult.
patient, they can actually crack a rib
The ribs, yeah.
during those chest compression. Like
Which
it's
is
very
true.
scary.
You can hear it sometimes,
Yeah.
but is let's keep the heart going,
Right.
and then we can fix everything else
Everything else
later.
later.
That's what it is, because the heart stop and you can bring it back, and
Yeah.
broken bone is not gonna matter, right? So that's what it comes down to.
And it's also important to note that they just don't leave the family members just by themselves. I think they usually call like a spirit, like the pastor,
A chaplain.
a chaplain.
A
Thank you.
chaplain will come
And be with the
and
family
yeah,
while this is happening.
talking to the family, or even before the chaplain gets there, another nurses, keep them, you take them to a place where they don't see what is really happening. Like you say, it can be really brutal, and you don't want them to witness that.
Right.
So yeah, that's what happened
During the code.
during the code.
Yeah. Now, what happens after the
Oh,
code?
man.
Let's say the patient made it.
So once the patient makes say everything is fine,
Right.
so now you have to go back and review what happens before the code, why this thing happened, right? And if the patient is doesn't sometimes we get lucky where the patient regains spontaneous, you just come back without any issue. Sometimes you have to intubate um, to to help the patient breathe.
Right.
But regardless, the patient goes to ICU for observation. So that's when the patient makes it, go to ICU.
Isn't it funny how they may say, oh, there's no ICU bed available, but as soon as it's a coded patient, it's like automatically
We
there's
find
an
an ICU bed.
ICU bed available.
We find an ICU bed. You mentioned that sometimes truly there's no ICU bed.
Right.
So they will transform a room. Let's say a patient is in uh, an IMU, which is a step closer to the ICU. So they will bring a nurse that has experience in intensive care to come take care of that patient in the IMU up until a bed is available. And then sometimes too they always do there is like there's a free bed in ICU just in case of those things, right?
Right.
So they will tell the floor, oh, we don't have an ICU bed, but in reality, there is an open bed just in case of something like this happen. So the patient can be taken care of appropriately. And in major hospital, in big hospital where they do a lot of surgeries, they allocate bed, ICU bed for surgical patients.
Oh, okay.
So if a patient after surgery needs to go to ICU, then those beds
Are available.
are open, so there's always like room, but not every, it's not information that is divulged. Everybody knows, but yeah, that's true.
All right, so the patient is going to ICU, intubated, going to ICU. The room is a mess.
Yep.
The nurse of that patient has to give a complete report to the ICU nurse of everything that's happening and stuff.
Yes. So the other thing too is I remember one of my first ever code. You as a nurse after the code, your nerves are like up the roof. Like, it's like the rush, the adrenaline rush is one thing that's like I can still remember like clearly. Like I don't know, after the experience, I realized that I was just jittery. Like I couldn't calm down, and I didn't understand why I was so I was so jittery. Like it's like having like a caffeine high, or you drink too much energy drink and you just like a all over the place.
This is how you know someone who really enjoys this field because I am telling you that when my first code, I was not jittery, I was not on any kind of high, I was scared.
No,
I was like,
I guess.
oh my gosh, what just happened? What did I just, like?
So I remember I had to kind of like isolate myself from everybody, kind of just calm my nerves down before I can, go back and take care of other people. but yeah, that's what truly happened to nurses, and you have to debrief. Like you debrief with uh, the rest of the team what we have done to prevent what just happened. And when you have students or preceptor, it's also a moment to cheat.
Right.
I know the nursing students sometimes they are scared.
Of course, like because it really does look chaotic in there. It looks
Uh,
like, and at that point, nobody's really focusing on you. Like if you're a student, nobody's paying attention to. In fact, they would just want to push you aside, like you're in the way. Like
yeah, you're on the way. Like, oh, either that's the moment for you to really, practice your
your
compression
compression.
skill, and also to observe
What's
what is happening.
All right.
And I believe it's always an exciting moment, in sense for newbies, because they get to learn, they get to see what is really what it comes down to. Because you sometimes you work in some department where you never see things like that.
Right.
If a person, a patient, a nurse works in rehab or med surg all the career, they might never see a
Yeah.
code.
Because those people are more stable.
More stable. But the other thing too is that, unfortunately, the more you see a code or the more you participate in one, the better you become.
Well, that's not unfortunate. That's a good.
Yeah, it's a good thing. Yeah, in a sense that you
get
improve on your
better, but it
skills.
just means that more people are pulled in also.
And you have to have a keen eye for it.
Mhm.
I remember where I just went to go pick up a patient, and I'm looking at the patient. I'm like, this is odd.
Right.
Patient is literally turning blue, and there was a nurse in the room prior to me coming in.
And the nurse didn't
They
pick it up.
didn't pick it up.
Oh wow.
And this patient is sweating, like breathing fast, and I'm like, oh no, wait a minute, this is not, is wrong. So you, you, you scream, hey, I need some help here. And by the time the help get there, you are pushing that code button, and you want to have people around, even if the patient's heart hasn't stopped, the patient is still breathing, moving around. You want to do everything you can to prevent the actual code, right? So slapping oxygen on the face.
And that's actually an episode, so don't give it away yet. That's actually an episode that we have when we talk about the subtle signs that
Okay.
before something like that happens.
Okay, so
Don't tell them all
that's
yet.
gonna be on our next episode.
Yes,
Dun, dun.
watch it.
So, what else can we say about code? So basically, that's what it is. So, and another thing too is in some institution, we we will have like you what do you call it? You holding a patient in the ER.
Okay.
Because there's not enough bed
No bed.
upstairs. Yeah, so you're holding the patient. So sometimes those patients are very critical, and they can also code fast, and you have to be on your toes.
I feel like if anybody's going to code, not that anybody wants to code, but if anybody is going to code, the best place to code is ICU or
Yes.
ER because they are the more skilled, or maybe even a step down the IMU units, but not really a med surgeon, a medical units,
Better code in the ER, and the ED,
because they have more hands on ground
deck.
there. Yeah.
People in my hospital, every now and then, you hear the code blue sound going on. It's somebody coded on the outside
Outside the hospital. Oh,
and
wow.
then the ambulance is on the way to bringing the patient to the hospital. And that's another thing we didn't talk about. But when a person code on the outside, there is a time limit for when the ambulance pick up the patient to when the patient gets to the ER, to what we call the cath lab. The cath lab is like an OR. They go look at the heart to see if there is any type of blockages that is what is causing. I don't know if I'm digressing from what we were talking about initially, but but yeah, because I find it very interesting, those moments, when things like that happen, and you see on the images where the blockages are, and this is why this person, well, because people drop.
Right.
And you're like, okay, why did they drop?
But do they usually go like if the ambulance is bringing them to the ER, do
Mhm.
they go from the ER to the cath lab, or do they get admitted first and then maybe they schedule like a cath lab
No, they
test?
go
So
through
immediately.
immediately to the
Okay.
cabinet. It's like uh, a window of time that they have to do that because the longer you they wait, the increased chances of demise, the chances of demise also increase. So you have to move fast. And then when it happened in the cath lab, then the patient also go to ICU.
Have there ever been instances where, let's go back to the hospital system now, where a patient codes in the medical unit
Mhm.
and comes out of it and stays in the medical unit, or do they always get transferred to
They always get transferred. If it's a true code, what I mean by a true code, let's say we did compression
mhm,
and we give medication
and they came
to
back?
resuscitate the patient. So you go to ICU because at that moment you require a higher level
Of
the
care.
patient require a higher level of care because you don't want to take the chance to leaving them in the medical
And the
surge
same thing
and then same
happens
thing
again.
happen. Always going back. I can't even think of a time where when I was working in a med surge unit, a patient code and we didn't take him
Yeah.
to the
Yeah.
ICU.
It's always straight to
Yeah.
either IMU or ICU
Mhm.
for so they can be hooked up to the monitor and being
Being
monitored
closely being
24/7.
closely
Yeah.
monitored. Yeah.
So I want us to shine a light on the nurse, the patient's nurse,
Okay.
because often they are overlooked,
Mhm.
but nobody ever thinks about how they feel, how
Mhm.
this impacted them, what this did to them psychologically or mentally,
Mhm.
or it's just everybody moves on, and before we know it, they're probably calling her to say, is that room clean? We need to bring another patient in, and she hasn't even had time to
To
process.
process.
I say she, but he or she hasn't had time to process what just happened, and
Mhm.
you're
Mhm.
calling her already, like, is that room clean? We need to send another
Mhm.
patient in. Are you ready for report?
As a Yeah, I think as a new nurse, it's emotionally charged, right? And you kind of have to, like I mentioned before, it takes your nerve kind of rattle. You have to take time to recoup yourself
Right.
first, right? And if and then the other thing is you kind of ruminate on yourself, like, okay, what did I miss?
Mm.
What could I have done to prevent this person from, from coding?
Mm-hmm.
You know, is it something like that's one of the main things? Like, is it something that I truly miss? Am I adequate enough to to protect this person's life, right?
Right.
So I think that's what kind of eat up on the eat up the nurse more than anything else.
Mm.
Okay. Sometimes it's just unfortunate there's nothing you can really do, but those questions always remain.
Right.
It always remain with you like, okay. That's why I you can always do your best as a nurse. Like,
Yeah.
you throw your skill out there, you do whatever you learn.
Right. And I agree, but I also believe that there should be a better way to that the facility can take care of the nurse, can help the nurse.
Mm-hmm.
I think give the nurse time to at least breathe
Mm-hmm.
before you start trying to push another patient to her.
Mm-hmm.
Give her, because these are the things that also kind of delay that she still has to chart
Yep.
everything that happened. Though the patient has been transferred to the
Mm-hmm.
ICU,
Mm-hmm.
she still has to chart every single thing that happened. So it's I just they just need to be taken care of better. I
So
don't know what the facilities need to do, but they
so
need to.
coming to that, like nowadays, early in my career, those things didn't happen. Like, but now they have like mental health support for
Okay.
nurses, and you can sign up for it, and somebody will talk to you. As a matter of fact, I'm gonna go back to the pandemic, right?
Mhm.
I think that's when it became
It
more,
started.
more popular, where they would tell us, hey, go talk to, they have like counselor on campus at that time that will, they will just come to you. Is there something you want to talk about?
Right.
But I remember I was like, no, I'm good. I'm good. But, but in retrospect,
Mhm.
I believe that I wasn't good,
Right.
but
So,
that's the
well,
time.
right. And I get that, which is good.
Mm-hmm.
Hey, that's wonderful because that's not something that was there before. But I'm talking about in that moment because this is afterwards. And look, maybe they will never do something. I
Mhm.
don't know, but I'm just saying that I guess maybe in an ideal situation, in that moment or right at that moment, give the nurse time to breathe.
To the defense of the facility or the unit, right? Um, we when I used to precept people, I would tell my, or even if you start a new nurse start working there, I will go back to them. People, actually not just me, everybody will be, are you okay? You need some time, you need to take a breather. And some people take a breather, like,
Right.
okay, hey, yeah, I need to relax a little bit. And we do that. It's kind of a nursing supporting nurses in that
When they're
aspect.
not eating their young, like I said in
In
the
the previous
previous
one. Well, I guess by
episode.
then you have been through fire and you are part of the team now, so they don't want to eat you anymore. So yeah, they within the unit, people will come, hey, do you need a moment? But the other thing too is the more you grow in your career, the more you have witnessed those type of things, you snap out of it faster.
Right.
It's like, okay, now somebody else need that bed. Now we need to focus on the next life to save.
Well, I mean, if you say so, I was what over 10 years in nursing, and I don't think there was a snap back fast. I think all the nurses that I've witnessed are always like, I mean, can I just let me just finish with this one first? And so hey, I've been gone for close to a decade now, so maybe things have changed.
You're right. I don't think you don't truly snap out of it. You you will talk about it. Like I think one another thing is within nurses we talk about it. Even when you get another patient in the room, you still talk about what just happened in that room. And you come home. I will come home and I will tell a story. I remember I would tell a story to my sister, and she's like, "Oh." But I think telling those stories was kind of a way for me to, let it go. Because perhaps I didn't have a chance to let it go right there and then when it happened, because hey, the bed is free now, let's get the next patient.
Right.
So
Well,
unfortunately, you have to come home and
yeah,
dump that on other people.
nursing it's
It's
one
a work of a heart. It's a
yeah.
work of the heart.
It really is because that's why in the previous episode I was saying that you need to be a nurse, you should really be a person of compassion and not just doing it for the money because there's so much that is involved in it. But I hope we didn't scare you guys too much, but we just wanted to kind of share the behind the scenes of what happens during the cold.
Yeah, that's I think that's about it, especially in the unit. In the ER is more chaotic, but in the unit it's just it's straightforward. It happens fast. You work fast to move that patient to another level of care.
But if you have any questions about what happens, maybe we didn't cover it and you wish that we did, maybe we didn't answer it, please you can go ahead and leave that in the comment section and we'll try our best to give you the answers to the best of our knowledge. Yes. All right. Well, thank you so much for joining us on another episode of Married to Nursing. We're so thankful for every single one of you who have tuned in, who have subscribed, who have followed, who have liked the videos, who have shared the videos. Um, we truly enjoy bringing these conversations, these topics to you all, and you engaging with the content is really helping it go far and wide. So we thank you so much. Now, for anyone watching or listening that haven't still subscribed, please go ahead and do that if you're watching on YouTube. And if you're listening on Spotify or Apple Podcasts or wherever else you get your podcasts, please go ahead and follow and leave us a review. Again, we truly appreciate you all.
All right. Thank you.
That's it.
See you next time.
All right. Take care. Bye.